Well, confidence coming from the administration as House Democrats are still scrambling to round up support for reforming health care. On Fox News Sunday, White House spokesman Robert Gibbs said Democrats will muster the votes to pass this bill. Take a listen.
We'll have the votes when the House votes, I think, within the next week. And I think whoever sits here this time next week, you all will be talking about health care reform, not as a presidential proposal, but as something that will soon be the law of the land.
Let's debate it. Ron Bonjean was the communications director to the former Speaker of the House, Denny Hastert. Maria Cardona is former communications director for the Democratic National Committee. Ron, first to you, what do you see the chances of this thing passing potentially this week?
Well, this boils down to really 37 Democratic votes in the House. The White House is trying to create a sense of inevitability that this bill is going to pass, but really no one knows for sure. They've been saying that for months. What this boils down to is the Democrats are trying to throw out transparency to change 1/6 of the American economy, and it doesn't really make any sense. They promised this would be the most transparent Congress. The White House made those promises. Democratic leaders made those promises, and now they're trying to pass the Senate version under the cloak of darkness. It doesn't make a lot of sense to me and to other folks that realize that transparency is key to making sure the American people are on your side.
Maria, let's talk about the confidence that we heard on all those Sunday shows this weekend. How do the Democrats plan on getting the votes this week? Who are they going to get? What block?
Well, I think what the House Democrats are going to focus on and what Speaker Pelosi and Clyburn are focusing on is what this bill is going to look like. Clyburn said that he didn't have the votes yesterday, Sunday, but that we will have the votes once this legislation comes out and once Democrats get a chance to look at it. Look, the bottom line is that Democrats agree that this is something that has to be done. And to Ron's point on transparency, this has been the single most debated bill in American history. So there's no question that the American people know what is in this bill. And frankly, the majority of the American people support the key components of this bill, which is increased coverage, security for those who have coverage, and bringing down the cost curve. And those three things will absolutely be in this bill. Once it is enacted, the American people will see and feel those changes immediately. And that's what Democrats are counting on.
Let's talk about the potential fallout. I want to play for you both what Lindsey Graham, Republican of South Carolina, had to say over the weekend. Take a listen, if you will.
When it comes to health care, he's been tone deaf, he's been arrogant, and they're pushing a legislative proposal, and a way to do that legislative proposal is going to destroy the ability of this country to work together for a very long time.
Destroy the ability. Maria, doesn't that worry you?
Well, it would worry me if the Republicans had been on board from day one in working with this president. But the fact of the matter is that they have made a cold political calculation to not work with this president. So be that as it may, we have to get the work of the American people done. And that's what this White House and that's what Democrats are focused on. We would love to work with Republicans. And in fact, the current bill contains 218 Republican amendments and a huge Republican idea, which is the health care exchange. What did that get this president? 0 Republican votes.
Ron,
so
finish
we're
up and explain your laughter,
make sure we do the work of the American people.
Yeah. No, you know, this bill contains job-killing tax hikes because it forces employers to pay a fee if they don't cover employees. What this bill really does is it forces people to pay more for their health care. In fact, there was a study by CBO that said 10 to 13% increase in hikes in family premiums. And to the fact that on the negotiations, Democrats are negotiating among themselves. Democrats are trying to pass this with their own votes. Republicans have offered their own ideas, but the administration passed some sprinkles on it after the health care summit in order to say that they tried to reach out to Republicans in a bipartisan way. This doesn't make much sense. The American people know it. And frankly, every day that they talk about health care and not talk about jobs and job creation and putting more money on the table, they might as well be calling in sick, because that's the #1 priority of the American people. And they're spending yet another week promising to pass health care reform. We'll just have to see if they have the votes.
Ron and Maria, we're going to have to leave it there. You know we'll be on this every step of the way. Thanks to you both. John.
Thank you, Jane.
More brutal attacks by the Taliban in Afghanistan. The government there says it needs help. So are those terrorists running scared, or do we need to send more troops to defeat them once and for all? Lieutenant Colonel Tony Schaefer with some insights next.
Every 72 seconds, someone in America develops Alzheimer's disease. Alzheimer's causes memory, thinking, and behavior problems. Doctors in our community are looking for volunteers to participate in a clinical study of an